most people are used to conventional medicine. You come in, you tell a doctor what your symptoms are, and then they write you a prescription or they send you to another specialist. So this is much different. I understand. And I'm very aware of how integrative medicine works, but a lot of the audience may not understand what exactly is expected, because you're saying, you're doing some coffee enemas, some juices and everything. That seems pretty simplistic. Can I just do it from home and not even visit you? Tell us about that process, expectation, cost. What would a patient really expect throughout this process at your clinic?
Yeah, so that's a good point. Why can't I just do this at home, right? I've been doing this 25 years. In 25 years, I've literally seen 2 people pick up that book there or Charlotte's book and be able to read it and put it all together as a package and successfully carry it out. 2 people in 25 years. Every single person that's come to our clinic, not one of them has said, oh, I could have just done this at home. The Gerson therapy is so highly specific. It's not just juices and coffee enemas. There are specific supplements, the quantity of supplements, the dietary rules. There are dietary rules that we haven't even gotten into yet. So it's such a highly specific therapy. So 2 to 3 weeks at our clinic is the mandatory stay. 2 weeks is mandatory. Most will stay 3 weeks if they can afford it and they have the logistical time to do it. So to come to our clinic, it's $6,700 a week. And that includes a companion. It includes 3 months worth of supplements. It includes airport pickup and back from San Diego to our clinic in Mexico and back. It's $6,700 a week. That's nothing compared to what conventional medicine costs, even if it's covered. I mean, when you're paying your deductible or you have to pay a portion of your chemo and whatever, it's bankrupting people. So $6,700 a week times 2 is $13,500 a week. And it's $20,250 if you come for 3 weeks. And then after you leave our clinic and you've learned everything specifically and you're confident with it to go home, you go home and you continue for the next 2 years. So that's it. It's not a major investment compared to half the things that we buy in life in order to sustain and live. People have spent God knows how many thousands of dollars getting sick. And so to be able to come to our clinic and do the Gerson therapy for 2 years compared to what conventional medicine would cost, it's a drop in the bucket.
People often don't realize that because they'll say insurance covers it. But at the end of the day, everything costs an enormous amount. I have to say, the other cost is not the financial side of it. It's the loss of your ability to live your life in a quality way and add value to your life. And that's what a lot of people miss, that chemotherapy is basically which one dies first, cancer or you. It is a poison. It is something that, most people, 50% never even actually get through. That's how bad it is. So you have to factor that in too, not just that financial side of it that a lot of people don't account for.